Well, hi there, everybody. It's Hank Linderman. This is Getting Angry. Today is Thursday, July 23rd. We've got a really special day because we've got a special guest. Dr. Gregg Adams is going to be with us in a few minutes. And I'm not sure if I want to embarrass Gregg. He's just one of the most impressive people I think I've ever met. He's a surgeon, he's a microbiologist, he has taught at Stanford University, and we met through a mutual friend. Anyway, I'm really proud that he's going to be here with us. Look, if you don't already know, I'm the Democratic nominee for Congress here in Kentucky's 2nd District. That's from just south of Louisville on down to Bowling Green, and over to Owensboro and across to Danville. If you notice behind me, any of you that are watching in from Bowling Green might recognize the green T-shirt in the background that has the white squirrel on it. That's the late and great White Squirrel Brew Pub that was one of my favorite spots in Bowling Green. And I used to go there and get fish and chips and meet folks while I was in Bowling Green. I hope the White Squirrel will open back up, but apparently they are a victim of the virus. Okay, thank you all for being here. Mark Andes is here. I'm really glad. As always, we're going to ask you all to share this. This is going to be a big one. But let's get to some numbers first. I'm going to start with, of course, our numbers related to the United States. This is yesterday, so these are numbers from Wednesday, the 23rd. Barbara Tichy is here. I'm so glad you're here. Gregg's not quite here yet, but we're going to get him in about 2-3 minutes. Notice that our numbers we're back up at almost 72,000 new cases, which is dreadful, and our deaths have jumped up. Now, Brazil is actually ahead of us in terms of the number of deaths, but that's kind of not much of an excuse. We're still not doing well at all. Let's also look at California, which is the new leader here with 12,000 new cases. Again, Texas is leading us of all the states, is leading with the most amount of deaths. But California is leading all of us with Texas and Florida close behind. So this virus is not even close to being under control. I'm looking at Kentucky. Kentucky's numbers are jumping all over the place. So once again, we've still got too many new cases, 480, but yesterday we had close to, I think we had the second largest amount of new cases that we had. A real quick story, here's a headline. This is a story in the LA Times that I suggest you read, and it's about California being impatient to reopen, and I'll read this. California recorded some of the first COVID-19 cases in America and the country's first known death in what would become a worldwide pandemic. It responded with the nation's initial stay-at-home order. Now the Golden State claims another dubious distinction: more confirmed coronavirus cases than any other state. California passed New York for that record Wednesday morning, reaching more than 409,000 cases, eclipsing New York's 886,000. And the LA Times speculates that the reason so many people that California is failing at this is because so many of the residents have been unwilling or unable to practice social distancing and mask wearing. Those are, of course, the best ways for us to deal with the virus. And Kentuckians, we have a very high infection rate right now, so please do yourselves a favor. Let's see if we can call Gregg. It's about time to do that. So let me dial him and see if we can get him on the phone. Let's see if he's coming in. There he goes. There's Gregg's number. And I'm going to get
Good afternoon.
Dr. Gregg.
Hello.
How are you doing?
Very good, thank you. How are you?
I'm doing all right. Well, I'm in lovely Falls of Rough, Kentucky. I haven't sent you a picture of my backyard, but it's quite beautiful. And, we met through a mutual friend, and I just got off the phone with Ed. And he said to say hello.
Oh, thank you. Ed's a lovely man.
He is a lovely man. And well, let's talk about this virus. You and I have already had a couple of discussions about this sort of thing. And I think in our first conversation, which might have been months ago, I asked you about the possibility of the virus being assembled or, intentionally designed in a lab. Is that possible?
Yes, it is a possibility to create viruses in a laboratory. But when you do that sort of work, you leave fingerprints behind on the DNA of that virus. When they've looked at the coronavirus that's causing COVID-19, they haven't found any of those fingerprints. And it has followed the normal rate of mutation that they would expect a virus to follow without any manipulation by mankind.
So as far as you can tell, it simply was not a manufactured virus.
That's correct. We have no evidence that it's a manufactured virus.
Okay, that's pretty conclusive. Now, what are your suspicions about where it came from, or what evidence do we have? Did it come from a wet market? Did it escape from a lab that was looking at it? Any ideas?
We can only have conjectures based on looking at the genetics of the virus itself and the history that we have of viruses doing similar things in similar pandemics in the past. And there's a very specific pattern of inoculation of viruses into the human populations by animals. They call it zoonotic spread, like coming from the zoo. Mm-hmm. And they have found very, very similar viruses in two different types of animals. What are bats, which is where they think that this one came from, and another is pangolins, which is a lovely animal that is protected in China, although there is a pretty significant black market in the trade of pangolin organs for medicines and fertility drugs and things of that sort. But they think that this probably came from a bat.
Oh, so would that lead to the wet market theory?
Yes, and that's as good a theory as any other.
Okay. And of course, there have been instances of research labs allowing a virus to escape. I think, didn't that happen in Atlanta?
Yes, there are research labs that have viruses that are similar to the coronavirus that is causing COVID-19. The letting a virus go, though, would have a specific spread pattern, and we haven't seen that spread pattern.
Okay. So the other day when we talked, you sounded very upbeat because you made a comment that that the medical science is learning how to deal with this virus very differently. You've learned a whole lot in the last 4 months, I guess, you've had of treating patients. What can you tell us about that?
It actually is a very exciting time. When you think about how we manage to battle diseases like the measles or polio or smallpox, it was a handful of labs and a handful of people. You all can probably name the two men who were responsible for making polio go away. When you look at what our response is to this coronavirus, there are over 190 different pharmaceutical corporations and biotech firms that are creating vaccines currently. Over 300 new drugs are being tested, and it's happening all over the world. And in the meanwhile, people who are on the front lines that are in the intensive care units have been sharing information in formal and informal ways amongst one another, so that we've come up with very quick and effective ways of finding out who needs what medications, who needs what ventilators, who needs to be admitted immediately, and who can safely recuperate at home.
So when a patient presents, when they show up at your hospital, how do you know who's going to be the most in trouble? What have you found?
When we look at our data of who is getting into trouble early in the course of their disease, they tend to be men over the age of 60 with one or more comorbidity, some other disease that would have already racked their body for a number of years, including high blood pressure, diabetes, cardiovascular disease, chronic obstructive pulmonary disease, or COPD, those sorts of things.
You know, I also remembered there was, I don't know if you remember, I don't think we ever discussed this, but there was a story floating around that tobacco smokers had some sort of additional resilience to the infection.
And some of those things are beginning to fall out of favor. We used to think that people who had asthma were not particularly affected, but we're finding out that that's not true. Asthma and cigarette smokers are as sensitive as anyone else. If you are abuser of opiates or methamphetamines, then you are particularly at peril of getting this disease.
Right. So I sent you an article yesterday from the BBC.com relating to saliva tests that are being developed in England, I believe in Southampton.
Yes.
Did you get a chance to look?
Idea.
Yeah, and they're testing it right now, I guess, on about 14,000 people. When they get finished with that test, they'll expand it out into 250,000 people. But their concept appears to be that this is, first of all, a non-invasive test, much nicer than having a swab poked, behind your eyeballs. And the idea is that they can get a result on the test fairly quickly, and if they can make the test inexpensively enough, that their population could take a test every week, and you might not even need to do contact tracing.
Correct. And there's lots of ifs to that. I think that the idea is lovely. It is the sort of idea that could only be implemented by a nationalized health organization like the Great Britain has. The concept is that they would test as many people as they possibly could, as frequently as they could. When you think about doing the tests that we're doing now, it's $30 a test. Now multiply that for them by 10 million. If they do it every week, the cost they estimate would be over £1 billion per month to do the testing that they want to do. And that essentially also requires that you trust the person who's doing the spitting. It is easier than having the swab put into your temporal lobe. That's a very uncomfortable test. But if you want to go back to work or need to go back to work and you know you don't feel good, you have your daughter spit in the cup.
I see. That makes a great point. Now, the other thing, I suppose, you'd have to do it in front of someone.
Well, and it's asking your population to be honest about the approach to it.
Boy, I hadn't thought about that. Yeah. Because
you want people to go back to work again. You want people to go back to restaurants again. You want society to open back up again. And their thought was that you would get a test result texted to your phone within 24 hours. And if you wanted to go to a restaurant would have the right to say, I'd like to see your latest test results. And if it was more than 2 weeks old, you may not get to eat in that restaurant.
Oh, my gosh.
If it was current, then you'll be able to eat in the restaurant. And so while it sounds like a wonderful idea, I can see a very valid civil rights sort of approach to not doing this test or saying I can eat here if I want to eat here. I also can see a situation where it will be simply too cost expensive to do.
Yes. What do tests cost nowadays here in the United States? Not the saliva test, but the existing tests.
About $30.
Oh, okay. I thought that part of that story was that they were aiming for a test price closer to $2-3.
And that would be wonderful, but it's still £1 billion a month.
My goodness.
Their point, though, is that their economy being closed down is costing them over 300 billion pounds sterling a year, and that this would be a pittance compared to losing that much money with having the economy shut down.
Absolutely.
Yeah, goal is to find a way to get the economy to open back up again. We all want that. We all want to have it also be a safe environment for everyone, because COVID is not going away magically. The only way that we can keep from spreading it is knowing that we don't have it when we are going out and being amongst other people.
You know, I have a concept that I've been haranguing everybody a bit on this Facebook Live thing that I do every day. And by the way, we're here Monday through Friday, 3:30 Central, 4:30 Eastern. And I call it going Godzilla on the virus, which is what it appears that nations like Germany and Canada and Singapore did, which was shut down the economy, pay everybody to stay home, and wait until your cases drop. I think in New Zealand, they were able to do 2 14-day periods, and at the end of that, they were done with it.
The virus does not live forever in the body. It doesn't live forever in the air. It doesn't live forever on solid surfaces. If you shut everything down and put everyone in a plastic bag for 2 weeks, this virus would shut down.
So that's not necessarily a bad plan, and it does appear to be what they did elsewhere. We do have a couple of questions, by the way, folks asked about. And David, I'm going to go backwards. David, you were a little bit late. Yes, Dr. Adams did say that. You have a different question. David Royce is asking if drug overdose deaths are killing more people than the coronavirus.
Currently, no. The drug overdoses are still present. Drug overdoses are still a very large public health problem. But as corona deaths peaked, they had occurred more frequently than overdose deaths. When we look at our death rates now, our death rates are dropping because we figured a better way to manage this virus. The problem with that number is we only have a handful of ICU beds in the United States. When you think about the number of types of illnesses that come from this one virus, we have just under 1 million hospital beds, of which about 78,000 are ICU beds, of which 70% are occupied by people who have non-COVID illnesses. So that means that you only have about 23,000 ICU beds on any given day. And if you're going to fill them up with COVID patients, we're going to run out of those beds. Yes. Our death rate's going to go up.
And I've been seeing stories about that in Texas in particular. Carl Wilson asked, do certain blood types have a higher risk than others related to the virus?
That's a fascinating question, and the answer is probably yes. They found this to be true also with the SARS epidemic in 2002 to 2004. When you look at the people who are most likely to get sick and require more care, they tend to be the people who are A blood type. And that if you have O blood type, you tend to have a protected status. Oh. You still have the capability of getting the disease, but it is less frequent by population than A blood type.
That's really interesting. Do you think all schools children should be vaccinated once the vaccine is available? Do you think all Americans are going to need to be vaccinated?
Yes, I know vaccinations are a specific hot topic, and the science behind it is very clear that we have made diseases like measles and polio and rubella and smallpox such rare events because of vaccination. Yes, vaccinations have side effects. Yes, there are some people who should never take a vaccination if they have an allergy to the way the vaccination is made. But it should not be a political issue. Vaccines work, and everyone should have one who can have one because it keeps the people who cannot have one safe.
I certainly agree with that. There was one other question, and it was related to populations that are already stressed. So, for example, someone who's a diabetic or someone who's had several rounds of pneumonia, they've got comorbidities. Should these be people that get ahead of the line when the vaccine comes out?
Yeah, because those are the people who are most likely to have a more severe disease or a higher risk of death.
Okay. Okay, that's great. I also wanted to ask you about the reporting changes that have recently been set up where we moved away from having hospitals report directly to the CDC, and now they're reporting to Health and Human Services. Is that right?
That's
And
correct.
and there's a new piece of software, there's a new piece of technology that's related to this. Have you experienced that yet? Does it appear to be working as expected?
Yes. So the fact that the reporting structure changed has a political overtone and not a more efficient dissemination of information overtone. I was reminded of a quote recently that if you mix science with politics, all you get is politics.
All right, that's true.
And but I'm also I'm heartened by the fact that there are dozens of other places to gather the same information that are not necessarily political. So the information that I get from the Johns Hopkins University, and there are a number of other places that are organizing these data and putting them into very helpful charts so that we can get a handle on what the information really is.
And look, this administration has not been the best with messaging. And it wouldn't surprise me they just didn't handle the messaging on this very well, that this is actually an improvement in the way that they're going to collect data, but they presented it poorly.
And without even putting the concept of politics on top of it, the way we battle diseases is with adequate and honest data. And so we need to have access to that, however it comes to us.
I'm going to guess that you have an opinion about single-payer healthcare. You mentioned the NHS very briefly earlier. How do you feel about the possibility of moving towards a single-payer system of some sort in the United States?
Well, I think that there are advantages to single payers that we don't enjoy in the United States. The ability for the UK to be able to implement a testing like the FIT test is a much simpler proposition. The fact that the UK doesn't necessarily have a hand in the pocket of the consumer at every step along the way of trying to stay healthy, including paying the CEOs and stockholders of device companies and pharmaceutical companies and insurance companies. And I would rather take care of another million people than to have the head of Cigna be able to buy another island.
I was going to say another house. You beat me there. Another island. Well, Gregg, let's talk about something uplifting now. Because when I met you for lunch, you talked with quite a bit of passion about your involvement with a couple of other things, and one of them is related to your latest project, which is called the Black Rock Forest Project. And I'm going to show a picture of that to the website to everybody so that everyone gets an idea of what we're talking about. I'm not seeing it, of course. Oh, there it is. So everyone's now seeing the splash page from the Black Rock Forest Project. Could you tell us about this?
Sure. I'm a believer, as was Will Rogers, that no man is truly safe without a hobby. And my hobby has been making art. For 30 years, I was using wood, and I have recently discovered the joys of welding and plumbing for propane. And I started making art, large pieces of art, with a group called the Flaming Lotus Girls. Made art for 20 years and have displayed it at the annual Black Rock City of Burning Man. This year, Burning Man is not going to happen, but they reached out to me to see if there was a way that we could keep artists engaged, because artists, like everyone else in America, have been out of work. Most of them have lost a lot of the commissions they had in place. And so we created a project called the Black Rock Forest Project, where we've asked artists to make a tree out of whatever media they want. If they're a sculptor tree, metal, glass, porcelain. We've had people write songs. We've had people write videos. We've had people do painting. and we started to collect them on a web page, different trees for different artists. And we now have over 60. We're hoping to get over 200 trees on this webpage to create a forest. Forests are diverse, they are interdependent, and they grow, and they're nourishing for the rest of the world. In 2021, when they reopen Burning Man for the public, we hope to bring as many trees as we can from this forest and plant them in the desert for the week-long event.
That's going to be fantastic. Well, let's hope there's a Burning Man next year.
Let's hope that there's an everything next year, although I do suspect that the world we wake up in will be a hybrid of what we used to know. And I encourage people to embrace that. You all are washing your hands much more than you ever thought you were gonna. Turns out your grandma was right. You have to wash before and after lunch. And it turns out a lot more. But the hybrid world we live in is going to keep us all a little bit safer. And I hope that we'll be able to return to all the things that we enjoy just as soon as possible.
Yes, I hope so too. And you're absolutely right. The world we're going to have after this is going to be very different. There's going to be no going back to the world that we had even 4, 5, 6 months ago. And of course, we're facing all sorts of opportunities for improvement or problems that we need to address. And we've talked about this before. That's why I'm running for Congress, is so that I can be part of making a difference in a positive way. Look, if for no other thing, if we weren't going to talk about anything else, it seems we have to talk about the damage that human beings have done to the climate, and doing what we can to be sure that our children, our grandchildren, and so on can have a place to live that's as vibrant and sustaining as the world is now.
Absolutely.
All right. Well, Gregg, thank you so much. I really appreciate you being here. And I hope you'll come back. I'm sure we're going to have more questions. So we'd love to have you come back if you're able to do it. And thank you so much for being here.
It's my pleasure. Thank you so much for what you're doing. And thank you all for listening.
All right. Well, Gregg, we will talk to you later. I'm going to stay on for a little bit. Thanks so much.
My pleasure. Thank you.
Take care. Bye. All right. So that was Gregg Adams. And yes, Gregg is from Stanford University. He, I believe he was educated there, and he has taught there. He's a microbiologist and a surgeon. Mark Maselli commented that I'm about to bump up into Governor Andy Beshear's time, which is in 2 minutes. So I'm going to say goodbye to you all. I think the thing we should end with is our picture of Godzilla, and we'll go from there. But thank you all for being here, and we'll see you tomorrow here at Getting Angry. Remember, we don't want to lose our damn minds. What we do want to do is use our anger, which is well-deserved, as a way of focusing ourselves so that we can do the right thing. All right. You all have a great day. Bye.